Mobile apps for behavioral health teams fail the moment staff hit a feature they can only reach from a desktop, and your team is rarely at a desk. When mobile access is partial, staff stop working in the moment and return to a workstation to finish. That is wasted time on every shift. The Behave Health app, a HIPAA-compliant, all-in-one mobile platform for behavioral health teams, free on both Google Play and the Apple App Store. Both staff-facing and client-facing versions are available, with the same experience whether your team uses an iPhone, iPad, Android phone, or tablet. The app combines an electronic health record, an extensive CRM, an organized ERP, and a built-in billing service, the same all-in-one system, on mobile. It is not a stripped-down companion app. It is the full platform your organization relies on, accessible from a phone or tablet. The app is designed for inpatient and outpatient treatment, residential mental health programs, detox, sober living, recovery coaching, and peer recovery services. When staff can't document where the work happens, paperwork piles up, and documentation is one of the biggest sources of burnout in behavioral health. Scribbling on paper and transcribing at a desktop hours later reduces accuracy and burns staff time reconstructing details. According to SAMHSA, workforce retention is one of the top challenges in behavioral health, and reducing administrative load helps. The Behave Health app is designed to provide comprehensive mobile access. Everything you do on the desktop version, you can do on the app. There is no hunting for buttons or information that can't be reached on a mobile device. The app is designed to mirror the desktop experience. Clinical notes completed on the app are designed to sync instantly with the desktop platform, so the record stays current wherever staff work. Beyond full desktop functionality, the app adds features designed especially for mobile devices. Here are 3 your team only gets on a phone or tablet. These are the capabilities that matter most when staff are on the floor, walking a property, or working remotely. First, push notifications. Notifications of upcoming tasks or events are sent straight to a staff member's phone, so nothing falls through the cracks. Second, location tracking. Location tracking is designed to handle automatic client check-in and check-out, a mobile-only capability that supports client location monitoring. Third, one-tap communication. Staff can call, message, or email program staff or clients with one tap, all from within a HIPAA-compliant environment. The app is designed to carry the work that keeps an organization running, from admission through billing and clinical documentation. Admissions, applications, and intakes are digitized, so the front door of your program lives on the same mobile platform. The app is designed to support automated integrated client responsibility billing and automated health insurance claims. Clinical and medical notes, treatment planning and progress tracking, bed management, shift notes, and incident reports are all supported. Using mobile devices in healthcare requires strict attention to security, and a purpose-built app handles standards that consumer tools often do not. Data on or sent from a device must be encrypted. Staff sign in with strong authentication, and a lost device can be remotely wiped. Generic messaging and email lack the audit trails, access controls, and encryption standards a behavioral health platform is designed to meet. The mobile platform gives your team a complete set of tools on both iOS and Android, whether they are on the floor, in the field, or working remotely. Complete progress, group, and individual session notes from a phone or tablet, with notes designed to sync instantly to desktop. Track bed availability, admissions, and discharges in real time. Supervisors update census from anywhere in the facility. Assign and manage tasks across the team, and get push notifications when tasks are due or completed. The app puts admissions, billing, clinical documentation, and communication in one place, so staff work in the moment instead of waiting for a workstation. Same EHR, CRM, ERP, and billing tools scale with your organization as it grows and diversifies across levels of care. Both staff and client-facing versions are available for free, designed to support HIPAA requirements on every device. Stop letting work wait for a workstation. Book a 20-minute demo of the Behave Health mobile platform at behavehealth.com. See full mobile EHR, CRM, billing, and one-tap communication built for behavioral health teams at behavehealth.com.